What is Pel-Ebstein fever in lymphoma? Pel-Ebstein fever is a unique type of fever that can occur in patients with Hodgkin lymphoma. This fever is characterized by cycles of high fever lasting about 1 to 2 weeks, followed by periods where the temperature returns to normal or even drops below normal for a similar duration. This pattern can repeat over weeks to months. While Pel-Ebstein fever is often associated with Hodgkin lymphoma, it is not typically seen in non-Hodgkin lymphoma. This fever falls under the category of B symptoms in lymphoma, which also includes night sweats and unintentional weight loss. These symptoms are significant because they help in staging the lymphoma and can provide insight into the prognosis. However, it is important to note that these symptoms are not exclusive to lymphoma and can occur in other illnesses as well. The cyclical nature of Pel-Ebstein fever makes it relatively specific to Hodgkin lymphoma. The exact cause of Pel-Ebstein fever is not completely understood. Researchers believe it may be linked to the immune system's response to the lymphoma. This could involve the cyclical releases of cytokines, which are molecules that signal immune responses, or it might be related to cell death within lymph nodes or damage to the supportive cells in lymphatic tissue. Diagnosing Pel-Ebstein fever requires careful monitoring of body temperature over time to identify the characteristic cyclical pattern. This diagnosis is usually confirmed alongside a diagnosis of Hodgkin lymphoma through biopsy and other tests. Treatment primarily focuses on managing the underlying lymphoma, often with chemotherapy, which typically helps resolve the fever. In some cases, anti-inflammatory medications may be used to alleviate fever symptoms. While Pel-Ebstein fever is recognized in Hodgkin lymphoma, it is considered rare and not a universal symptom. Non-Hodgkin lymphoma tends to present with different symptoms and clinical patterns. In summary, Pel-Ebstein fever is a distinctive fever pattern linked mainly to Hodgkin lymphoma, reflecting the complex interactions between lymphoma cells and the immune system. Recognizing this symptom can assist in clinical diagnosis, but it is essential to confirm lymphoma through established diagnostic protocols. Always consult a healthcare professional for personalized medical advice and treatment options.